I have a retired Special Forces individual who was shot locally, got shot in the pelvis, went across his pelvis and cut across his spinal cord. So he suffered essentially what's called cauda equina syndrome, or a spinal cord injury. And the first day he came in the clinic, he had seen his neurologist, he'd been through the VA, he'd been through multiple physicians, and they're like, this is your new norm. And he's walking in, he can barely walk at all. And through the course of 1 year, he was shot in February of last year. Last week, he was running a 720 mile.
Who gave me a podcast? This is Jeff Allen. Welcome to my podcast.
Hey, everybody, this is Jeff Allen. Welcome to Who Gave Jeff Allen a Podcast. We will find you. We are looking. There's 6 billion of you out there, and we will find you. Today's sponsor, as it always is every week, Nordic Wave, a cold plunge. It's a big Yeti cup. You just put it on your deck in your basement, fill it with cold water, sit in it, and it will transform your life. Embrace your inner Viking. That's right. Be a Norseman. Cold plunge. We'll talk about it today with today's guests. And like I said last week, if you got a lust issue, it's a great thing to cool the jets. So
That's true.
That's true, isn't it? Anyway, today's guest, I've been looking forward to this, Dr. Trent Nessler. People ask me all the time on the road, what is your podcast about? I never wanted to get niched into any one particular area because I like a variety of things, like you. You like watching different things, and I like a variety of things. But the health and wellness area is something I'm leaning towards because of my age, and my parents, when they were my age now, 70, my father could barely walk. He had to give up the game that he loved, golf, because physically he couldn't do what he would, and that is not the way life should be. God did not intend us to wither up and die at 60 years old and just sit and wait for the Grim Reaper to come and grab us. So I'm leaning into that area a lot more and more. I'm learning more and more as in my own journey. So I would love to help you guys navigate through the noise, because if you're like me, you go on the YouTube, in the internet, and there's a lot of noise out there. I have a doctor in town here. He's a nurse practitioner, but he was with the Special Forces. We're going to have him on the podcast coming soon. He's my kind of go-to guy to sort through some of the noise here. Today we'll sort through a lot of it with Dr. Trent Nessler, is a doctor of physical therapy and one of the country's leading voices in injury prevention, movement science, and performance longevity. For over 2 decades, that's 20 years for you Gen Zers, if one of you happened upon this old man's podcast. You didn't tell us we're going to have to do math. He's worked with everyone from elite athletes to everyday people trying to stay active, pain-free, and strong as they age. I'd love to talk to you about the pain-free thing, because my son recently asked me, "You look like you're hurting." I go, "If I wasn't hurting, I think God called me home." So the pain-free part, but the cold plunge has helped tremendously with that. He's the founder of one of the nation's largest movement assessment programs, which is what?
It's called the VMove Plus AMI, Athletic Movement Index.
Okay.
It's a wearable sensor technology.
Oh, wearables. Oh, I like that. And we'll talk about that. I haven't even introduced you yet. Yeah. So for those of you who are wondering who that was, I will tell you in a second. We're off to a good start on this one.
Fantastic.
We've kept the ADD people. They're with me, but the sane people who are focused are gone. They have gone on to another channel. What makes this perspective valuable is he's not just focused on performance, he's focused on sustainability, which is important, especially for people over 40 and 50. And that's the issue I want to talk about, because I've had this discussion with my wife, who's coming up on 65. Anyway, who don't want to just live longer but want to feel good doing it. Absolutely. Lately, Dr. Nessler has been at the center of conversations around hormone optimization. I will talk about that. Peptides, love to talk to you about that. I have no idea what they are, but I drink them. Recovery tools like red light therapy, cold exposure. Cold exposure. I like the cold plunge. I don't want to live in the cold weather. That's why I live here. What actually works versus what's hype, especially for people who feel like their body isn't responding the way it used to. So whether you're someone who hasn't worked out in years or someone who's done everything right and still feel like you're slowing down, this conversation is for you. Dr. Trent Nessler, I'm glad you're here.
Thank you so much for having me.
Well, you'll say that now, but will you say that in an hour?
Absolutely. This is
all
the
right.
kind of
Where do you
stuff
begin? Where do we begin? Your journey. You didn't look like that when you came out of the womb.
No.
So,
I've always been into fitness my whole life. Really started working out around the age of 10. I'm 57 today, and still weight train every single day. Train Brazilian Jiu-Jitsu. I'm actually a black belt in Brazilian Jiu-Jitsu. I've been training that for about 15 years. And as a physical therapist, early on in my career, I started my career in 1997. And so as an early physical therapist, even back in those days, I was already talking to patients about nutrition and the importance of nutrition. I had received a minor in biochemistry, so I got a really intimate understanding of how the chemistry of your body affects all of your body's ability to repair. And, back in those days, it was kind of like voodoo science, so to speak. There was not a lot of correlation to, what you're putting in your body and how your body's actually healing. Fast forward to today, I think there is no other time in our history where considering this stuff, especially from a regenerative, maintaining your fitness into your fifth and sixth and seventh decade, there's no other time in our lifetime where it's been more important. Just simply because of so many of the chemical changes that have occurred with the American food system and what that's done to the human body. And how, when you have an injury, your body really needs certain things to help supplement it, to help it heal in that process. And with the technologies that we have available today and some of the nutritional supplements, things like peptides and stem cells that we have available today. Matter of fact, as of, I believe it was yesterday, stem cells was actually legalized in the state of Tennessee, which is absolutely amazing.
Well, it's funny because my manager ripped his ankle up, got to be 10 years ago, and he had stem cells. His chiro recommended it.
Yeah.
Healed his ankle right up.
Yeah.
And he had tried everything else,
I will tell you, again, I've been in this profession for 28 years. And what got me started, just to give you a little bit of a history of like what got me to this point. I was 10 years old. My father, we were on a family vacation. My father was involved in an accident, and he broke his neck while we were on family vacation in a third world country in 1979. So it's bad enough to be a third world country, but a third world country in 1979.
California?
It was close. It was Trinidad.
That's a joke.
Yeah.
That's a joke. If you're from California, I was serious.
Yeah, but it's what he was able to do, this was 1979, he broke his neck. He was a C5, 6, 7 spinal cord injury. And when I got out of PT school, it was about 25 years, he'd been in a wheelchair. And we put him on a diet. We put him on an exercise program. And we did all of these other alternative medicines. And he went from a wheelchair for 25 years to up and walking with lobster and crutches.
Holy cow.
Yeah. And at that time, this is back in the late 90s, early 2000s, he got there was a lot of publicity around it and things like that. We actually wrote up a couple of papers on it. But what it taught me is what the capability of the human body is when you provide it the right tools to progress along the path. And I'll bring that forward to today. I deal with a lot of athletes. My clinic is called the Athlete Lab, so we deal primarily with athletes, really anybody who is trying to maintain their physicality and do the things that they want to do. I also tend to get a lot of special forces guys. And I have a retired special forces individual who was shot locally, got shot in the pelvis, went across his pelvis and cut across his spinal cord. So he suffered essentially what's called cauda equina syndrome, or a spinal cord injury. And the first day he came in the clinic, he had seen his neurologist, he'd been through the VA, he'd been through multiple physicians, and they're like, this is your new norm. And he's walking in, he can barely walk at all. And through the course of 1 year, he was shot in February of last year. Last week, he was running a 720 mile. 720.
Holy cow.
But we did absolutely everything with him. We did stem cells with him. We did peptides with him. We did cold plunge with him. We did red light therapy with him. We did what is called BFR, blood flow restriction training with him.
What is that?
So blood flow restriction training is the use of a cuff on your limb while you exercise. And when you do that, what ends up happening is you create this oxygen deprived state in the muscle. So what ends up happening is that when you do that, you have this oxygen deprived state in the muscle is recruited more. So you get more of your quad recruiting. It's really good. We use it a lot for like ACL reconstruction, things like that. People who are having a hard time recruiting their quad, because you can get good quad recruitment at very low loads. So you don't stress the injury, you don't stress the surgical site, but yet you create a physiological response as if they're doing heavy resistance training. But the real key of in my opinion, what BFR does is what it does to you systemically. So one of the things that blood flow restriction training does is that when you do it for a long enough period of time, is you cause your body to release large amounts of growth hormone and IGF-1. IGF-1 is really important for bone healing. So those who have osteoporosis, osteopenia, super important for those, but also the growth hormone. So if you're feeling, that you're getting weaker, if you feel like you're losing muscle mass as you mature, BFR is an amazing way to help to accelerate that, to accelerate the muscle growth. But the coolest part of it,
you just can't because of the DIY society we live in. Don't take a belt and tie off your quad.
Amen. Thank you for saying that, because
I just had this image of people go, why should I spend money on that? I'll just tie off my quad.
Exactly. There's a difference between a tourniquet and blood flow restriction training. Typically we're going around anywhere from 40 to 60% limb occlusion. So versus a tourniquet, which is 100%. And more is not always better. But the real key,
so there's a science behind it.
There's a lot of science behind it, and it was really it really started back in the 60s. You and I are close in age, and one of the things, if you remember back in the old days in the Muscle and Fitness magazine, Arnold Schwarzenegger wrapping things around his biceps and doing bicep curls. That was the earliest version of BFR. It actually started back in the 60s with European bodybuilders. So Franco Columbu, Arnold Schwarzenegger, like all of those big names back in those days were using early forms of BFR. The medical community really did not get an awareness of it until a physical therapist at the Center for the Intrepid was dealing with a lot of these Iraq war injuries. And he was trying to get people back to theater quicker. And one of the things that he found is that by applying these principles of blood flow restriction training, what he was able to do is get people back stronger, faster, and back to the theater in a safer fashion, in a much more expedited fashion. So that was really kind of in the like 2010, 2015 era. So it's still fairly new knowledge. But as we use it more, we research it more, we see what the systemic effects of BFR are. You can leverage other technologies like your red light therapy, like your cold plunge. You can leverage things like peptides and things like that helps to accelerate or accentuate the recovery piece of it.
Okay, peptides. I know that's let me back up.
Yeah.
Just in my own journey, because I might as well, while I have you here, for free.
For sure.
Get some information. The NAD.
Yeah, NAD
drips.
plus. Yep.
Drips.
Yep.
Are they a fad or?
First of all, you have to look at what NAD plus is. And for every molecule of NAD plus, you get 5 ATP. ATP is the energy that the cell runs off of. So part of the reason that it gives you energy after you get it is because you're essentially superdosing your body with energy, or what your cells use as an energy source. So is it valid? Absolutely. And when you combine it with other things in the equation, so like BFR, when people are doing BFR training, one of the supplements that I recommend is also supplementing NAD plus.
Now, NAD, can you get it in a pill form, or does it have to be in a drip? Because I do the drips.
You can get it in a pill form. I actually take it in a pill form. The drips are more intense.
Yeah.
And
like getting hit by a truck.
Right. And as you know, they're more time consuming, because if you go in and you try to do a 60-minute drip in 30 minutes, you're going to not be feeling too well.
No. Well, then I see it. They do give you some, I think it's vitamin B after that, and it makes you, it wakes you right.
Yep.
But yeah, that, the first one I did took an hour and a half.
Yep.
Second one was an hour and 15,
Yeah.
and I did an hour.
Yeah.
And the hour was max. That's it. I'm not going any lower than that. I mean, it was literally like I got punched multiple times. And as a 70-year-old, you sit there and go, if this turns out to be a fad, and I'm doing this to
well, you know, here's the thing that
and it's not cheap. By the way.
it's not. It's very expensive.
Yeah.
You know, you're lucky if you don't spend $250 or more per drip. You know, so the thing is, though, is that if you're doing that in isolation, is it worth it? I'm not really sure. Right. Because if the rest of your day means that you're consuming, you know, traditional American diet, it's probably not going to do that much for you. But if you do that as an adjunct to everything else that you're doing, absolutely. When you start talking about things like cold plunge, red light therapy, so, you know, for example, when you're doing NAD plus and you do red light therapy, so what does red light therapy do? Red light therapy stimulates down in your cell. Inside of your cell is called the mitochondria. The mitochondria is the powerhouse for the cell. So when you're stimulating the cell, you're basically getting the mitochondria to turn over protein synthesis faster. All that simply means is the cell regenerates faster. When a cell regenerates faster, what that means is that the injury, the soft tissue, regenerates faster. So when you're throwing things like NAD plus into the equation, which provides the cell energy to do the work, and you do the red light therapy in conjunction with that,
it's healing the
it's
cell.
a win-win.
Yeah.
You know, so I think where most people lose, they don't get the full benefit, is because they don't do all the things in sequence, all the other things that could help, you know, result in that NAD plus having the maximal effect that you possibly can.
Okay, yeah, because I'm down to doing it once a month now.
Yeah.
I did the load, and then for the last 2 months I've done the drip, and then my testosterone was at almost zero. I mean, it was. I just realized I'm walking around like a zombie.
You know,
told my wife, I said I don't want to do anything.
Yeah.
I mean, and for the first time in years, I mean, I missed almost 2 weeks of not hitting the gym, and I finally go, I wonder, you know, it's been a while.
Yeah.
So I got my blood test, and she said to me, I've been going to the same lady for 15 years. She said, you've never been this low.
Well, you know, and to me that is when looking at testosterone and the way that the medical industry looks at testosterone, I just read a interesting study not too long ago. Back in the 80s, a 60-year-old male who was 500 was considered low.
Right.
Today, it's 300. So what you've seen happen is testosterone's kind of plotted on a bell curve. And if you go, you know, you got your bell curve, and in the middle is where everybody should be. You're one standard deviation below that, 300, then what ends up happening is that's when you're low and you're considered for testosterone supplementation. The problem is that curve has shifted low. And the biggest part of that is what we eat. So the foods that we eat today are actually causing suppression of testosterone in men. And what you're seeing is a whole generation coming up that are much lower T than we were when we were kids because our food was more pure.
My doctor told me that back in the 50s, the average male at 50 years old, 1950s, a 50-year-old male had a testosterone level of between 1,800 and 2,200. And she said now it's like 600 to 800. And I was at 375.
Yeah.
Which explained everything.
Yeah, for sure.
It's like, it really did. I mean, and that was a week ago. So I'm starting to get, I hit the gym the last 2 days. I'm starting to feel energized again. And my brain fog is leaving. Which is great.
Yeah.
At 70, I'm worried. My grandmother had dementia.
Yeah.
And I do understand that they're calling dementia diabetes 3 in Europe.
Right.
Explain a little bit about that. What sugar has an effect on a long-term effect. Is it? It's not the sole cause, but it certainly has gone through the roof.
It has.
And I mean,
and
early onset.
And I mean, very early.
Early onset. We have somebody in our small group. She's not even 50. I think she's 57.
Yeah.
And she's been diagnosed with early onset.
Yeah. And I tell you, in sugar is in everything.
Yes.
It ketchup. I mean, it's pretty much in everything, and over time, it is your body's not meant to have that level of sugar. When it comes to understanding all of the connections to dementia and things like that, I'm probably not the person to get into a lot of detail with that. That being said, what I've seen is the inflammatory responses from sugar and other substances. We have a lot more foods in our system today that are inflammation in nature, causing a lot of gut issues, causing gut inflammation. And what I see from the PT side of things is that when you've got a total knee replacement, for example, that's common in this population. When you have a total knee replacement, that the swelling that person has after a total knee replacement, if their diet is junk and they're having gut issues, their swelling, not only is it bigger, not only does their knee swell more, but it lasts a lot longer. And that has a huge downstream effect on your body's ability to recruit muscle as well as heal. When you've got that much inflammation, healing that is more difficult. So anything that, part of the reason that, when I see clients, I'm making not only nutritional recommendations, but I'm also making recommendations around peptides. I'm making recommendations around all of these other
things. Let's get into peptides.
Yeah.
First of all, what are they?
They're short chain amino acids. That's the probably one of the biggest misconceptions I see around peptides is that people think it's an anabolic steroid because you're injecting it. And what people need to understand. You
inject them?
You do.
Oh, I've been taking a powder, collagen peptide. Bubs,
so collagen peptide is good.
From Sean Ryan.
Yep.
His show. I watched his show. He advertised Bubs.
Yeah. So the collagen peptide is good, taken orally. The peptides I use are like BPC 157, TB 500. That's the main.
Man, that sounds really cool.
You'll even like what everybody calls it is the Wolverine pack.
Oh.
Yeah, because I was first introduced to peptides because I deal with a lot of fighters. And it's very popular in the fight medicine because what you see is that fighters are going back faster and recovered to a higher rate. And so
it also helps recover from weightlifting.
There's another cycle that I will do with people as they move out of the injury state and they're looking to build more. That does a lot with cell regeneration and muscle growth. That's often referred to as the anti-aging stack. So there's different stacks depending on what you're trying to accomplish. For me in my setting, I'm always trying to accomplish one of two things. Number one, recovery from an injury, or moving them to the next step and really pushing performance enhancement. And what I will tell you is that the misconception about peptides is that it's an anabolic steroid. And the difference between peptides and anabolic steroid is your body goes from through a chemical reaction to create testosterone. And it goes from chemical A plus chemical B to equal to testosterone. And what anabolic steroids do is they bypass that chemical reaction and provide you the end product. So what ends up happening is that your body senses that and it starts to shut down these chemical reactions because you're artificially supplying it. What peptides do is they actually give the building blocks so that A can go plus B to testosterone. So you're
So
supplementing.
it's a natural progression.
Correct. You're supplementing the chemical reaction to get you to your end product. That's the biggest difference between, in my opinion, between peptides and anabolics, because you don't mess up the body's ability to naturally create the hormone. And what I see is a significant improvement in outcomes. I'll just give you a perfect example. One of the main injuries I see in my practice is ACL injuries, anterior cruciate ligament injuries. Just watch any NFL season, you'll have multiple of them. And that's typically 9 to 12 months to get back to sport. And I've had ACL, PCL, LCL that's gotten back to professional fighting at 7 months. I've had total knee dislocations, which is your ACL, PCL, LCL, MCL, and your hamstring ruptured. And he was back on the mats in 1 year. It's unheard of.
Wow.
In my experience in 28 years of practice, I've never seen the level of outcomes that we're able to have today when you consider all of the different chemical aspects of it, the biochemistry of healing, combined with technology, combined with the right therapeutic
And these are all young bodies as well, right?
No,
But,
not all of them. So because I'm 57 and I'm a black belt, I get a lot of guys who are training jiu-jitsu in their 40s and 50s who are like, how do I keep going? Because it's rough on your body. I mean, it is a very rough sport, to say the least. Not encouraging anybody over 50 to try starting
That's
training
like saying,
jiu-jitsu.
I like banging my head against the wall.
Exactly,
But,
exactly.
How do I keep doing that without hurting myself?
Pretty much, so a large part of the population I deal with are those really in their mid 40s to, mid to late 50s, and trying to help them maintain their physicality, their power, their strength, their endurance, as they're, competing.
Yeah, because I can just vouch, knowing my 50 was where everything just started falling apart.
Yeah.
We were talking off air, and I was trying to take a golf lesson. I was taking a golf lesson one day, and the guy goes, "What are you trying to do?" And I told him, he goes, "You physically cannot do what you're trying to do." And what do you mean? He goes, "You can't. You're not flexible enough. You're not strong enough. Your core isn't,
Yeah.
And he went down the whole line.
Yeah.
He said, a lot of this is glutes. He goes,
Yep.
"When's the last time you did a squat?" I go, "What? I don't know."
What's a squat?
Yeah, what's a squat? And I started maybe at 55.
Yeah.
Really just figured I might. And, I was always a runner.
Yeah.
Which is why I've had both hips replaced.
Yeah.
But I was always a runner. And I felt that with the alcohol and the drugs I was doing in my youth, if I sweat, I was at least getting rid of the
Sure.
poison. That's I naively thought if
Sure.
I could continue to do what I was
Right.
doing, as long as
Right.
if I ran 8 miles,
Get
I was
rid of the poison.
then I could just kill myself at night and then
Yeah.
run 8 miles the next day.
And be feeling good.
Yeah, in your 20s and 30s, that
works.
That works, But then all of a sudden, you're 6 miles, 4
Yeah.
miles, 3 miles, 2, and God, it hurts.
Yeah.
Again, I was into. I remember colon cleanses.
Yeah.
Were big back in my 30s. I remember me and a couple of other comics were at the GNC buying stuff, which is interesting because now I just got cleared for life from colonoscopies. So whatever I did in my 30s, cleansing my body out, it must have done something.
Yeah.
And my shoulder tore. I just went through a year and a half ago, and I've not really gotten back to where I was in the gym.
Yeah.
Because of that frightens me.
Sure.
I've had both hips replaced. The second one, the physical therapist told me. I mean, I leading up to my surgery, I was doing 500 body squats a week. And when I got into PT, he goes, "You're so far ahead of our protocol, and we're not allowed to move ahead.
Yeah.
So there's nothing I can
Yeah.
do for you, really. Just, so I was hitting golf balls like
Yeah.
in 4 days. I mean, it was
Wow.
amazing.
Yeah.
The second hip, the
Yep.
first hip, they cut into the muscle, and it took weeks, months to get that
It's been a
healed.
lot of progression of the types of surgeries that they do too.
Right.
So a lot less trauma.
Yeah, but the shoulder
Yeah.
is a completely different animal. I mean, it scares me to
Yeah.
rip those again. So I hired a trainer online. He's a golf fitness guy, but I told him, I said, I just want stability in my shoulders. So it's a lot of band work,
Yep.
and it's funny. I go to the gym now. I
Yeah.
see guys doing
Yeah.
all the bands.
Yeah.
I go, shoulder surgery? Yeah.
Yeah.
Labrum,
Yeah.
Speak on coming back from injuries.
Yeah.
And obviously, if you're going to a physical therapist, they're going to walk you through the right
Right.
areas. People like me who got away from, obviously you run your 30
Right.
days or whatever they give you,
Right.
and then you're on your own. Traditionally for me, because I'm an addict and I'm an idiot, I always pushed everything too
Sure.
hard. I've always thought more,
Yep.
if I was to do that PF
More is
whatever.
better.
Oh
Right.
yeah, I would. Well, let's go tourniquet.
Yep.
Let's
As
get
long
it
as
at
my limb is turning
98%.
blue, I'm doing good.
Yeah, if 70% is
Yeah.
great,
110%.
I used to do the
Yeah.
joke. I take 5 a leave.
Yeah.
Who takes 2?
Yeah.
Sure, my stomach burns, but my knees don't hurt.
Yeah. Well, and it's funny because the particular BFR cuff that I use, I actually was on the medical board for as we were developing it. And one of the things that was important to me is that I have a cuff that does not fully occlude for that exact reason, because most of the people that I deal with choke each other, punch each other. So they're going to be in the exact same situation. Right. They're going to be, if 60% is good, if my limb is turning blue, it's even
Right.
better. And that's not the case, because you can actually create a lot of damage.
Well,
doing
that's
that.
like the cold plunge. Initially, I set it at 50, and then I got down to 45, and I see the progression. So I
Yeah.
started researching.
Yeah.
Is colder necessarily better? And then they talked about hypothermia
Yeah.
will enter at 10 minutes.
Yeah.
You get to 10 or 12. I noticed you
Yeah.
said you do 10-minute
Yeah.
cold plunges. I
Yeah.
keep it at 6.
Yeah.
6 to 8 at 50 degrees. I went back up to 50, figuring, do you get better? I mean, if I can get to 38?
Yeah, it really depends on what you're looking for. There's
Inflammation reduction.
Yeah, there's a lot of research out there about doing cold plunges after your workout, and what that does to your gains that you get during working out. And I think I shared with you, for me, after a hard jujitsu training session, sometimes I feel like somebody just took a bat to my body. And my cold plunge sits at 39 degrees. It does circulate. And typically I'm trying to get people in there for about 6 to 8 minutes. And the reason that I'm doing that is twofold. Number one is a vagal nerve reset. The vagal nerve, it's the longest nerve in your body. It goes from your brain down to your feet, has connections to your heart, has connections to your lungs or to your kidneys and your liver. So it has a direct effect on connecting your brain to your heart rate, to hormone release and things like that. So when it's overstimulated, that's a response to stress. Now, whether that's physical stress from an injury or that's emotional stress from work or trauma or whatever, a lot of people come in with that nerve overstimulated. So part of my goal when I do a cold plunge with somebody is to really walk them through the breathing process so that they can control their body. So at that temperature, it's hard to control shivering. And the techniques that we teach people to do when they get into the cold plunge really helps them to control that shivering. And then the second piece of that is by taking them in there to that 6 to 8 minute time frame, what we're doing is we're getting a release of what's called a P3 protein. Now, P3 protein is typically only released when your body thinks it's going to die. You're not going to die in there, but we're stimulating the body to
The
think.
first 30 seconds you feel like
Well,
that.
the first 3 minutes you may feel like it. But the idea is to get the body to release that, because then what we're going to do is we're going to put you on the bike and we're going to flood your body as well by using BFR with growth hormone and IGF-1. So there's a lot of times that I'm using these things to create a certain chemical response so that I can enhance that with the next chemical response. and then enhance that with the next technology I'm going to use. So, for example, if somebody do a cold plunge, we put them on the bike, we warm them back up, we flood their body with growth hormone, IGF-1, with the BFR, and then I take and I use class 4 laser on them. So class 4 laser is really effective at helping soft tissue healing. It's a form of red light, so it works the same at the mitochondrial level, but it's much more intense. So this, I could not sit a class 4 laser on your shoulder and laser it and not move it because it would burn. So you have to keep it moving as you go. But the idea is that we're creating this chemical environment to optimize that when I stimulate your cell to regenerate at a faster pace, it's in this chemical environment that's enhanced for that to occur. And that's really where peptides and stem cells and all of that really kind of fit into the equation. Because what I found in healthcare is you have your stem cell silo, you have your peptide silo, you have your PT silo, you have your nutrition silo, and none of these ever communicate together. And one of the things that I have found is where they're true, the best exponentially greater outcomes come from is that when you bring all of these things together and use a mindset of how am I using this cold plunge to enhance the next thing I'm going to do, and how do I use that to enhance the next thing I'm going to do? Because that, to me, that's where the real gold nugget's at.
Well, it's interesting because the first time I did the combination, I remember driving back to the hotel. I was on the road. I had heard about, when I was in Montana, we would go into the natural baths, and then I would do the cold, and found that fascinating, just to come out of a 103-degree mineral bath and then sit in 45-degree water. And when I told my wife I was going to get one when I got home, I was going to buy a cold plunge. And she said, why? And I go, that's a great question. I don't know. So I did a little research. They talked about the brown fat. And but I did read about you want to sit up here, so I wanted to make sure that my Nordic Wave, Jeff 150, save $150. Nordic Wave was deep enough to cover that. And again, there's a chiller machine that rotates the water, and I can set it. I think 38 is as low as it goes. I didn't go up to 100. Whatever, if I wanted, my wife goes, well, you get it up to about 95. She goes, I'll sit in it. My favorite thing she does, she'll walk by and she'll take the water and splash her wrist and go, I feel it. I feel it's better already. That's awesome. It's so funny though, but it's either you love it or hate it. I mean, it's not something you would normally want to do.
No.
So there has to be a long-term benefit. Again, driving back to the hotel that day after doing the combination, I called my wife and said, a man my age shouldn't feel this good. I felt amazing. And when I'm home, and I have both now. I have the infrared, I have the red light, and I have the cold plunge on my deck. Infrared, now I've been reading this. Again, this is stuff that you don't know if it's a fad. It's the noise on the internet.
For sure.
Your toxins, sure, it releases them, but they get stuck in your liver. So you need some kind of supplement to clinch. Now, I do the glutathione at the drip. I get the glutathione drips, which is supposed to help cleanse the liver. Is there something to that where you do infrared that it's not necessarily detoxifying?
One of the biggest mistakes when it comes to red light, not necessarily related to toxins, is how it's put into the equation.
I'm talking about infrared. That's the same thing?
Yeah. So infrared, red light therapy, it's all the same. Class 4 laser is a version of red light that's much more intense. So like the particular bed that I have, it looks like a sun tanning bed. It has 4 different wavelengths to it. So it goes from skin all the way down to deep tissue. Most places you go, they put you on a table and put a panel over the top of you. It would take you about 30 visits of a panel to equate to one of these beds. And what I see is there's a lot of recovery places out there where people will do red light panel, and then they go into the cold plunge. The problem with that is that what you're doing with the red light therapy is you're stimulating the cells to be more active. and you're stimulating them to be more active and to regenerate at a faster pace. And as soon as you jump into a cold plunge, you shut that off.
Okay.
So typically what I do is I have people go cold plunge, then red light.
Well, see, that's what I do at home.
Yeah.
Well, I actually go cold plunge, shower, and
Okay.
then red light.
Yeah.
Yeah,
And that's
I
perfect.
want to
And
get warmed
that's
up.
and that's perfect because, in that sequence, that's the right. But
And we
there's
have
also,
half a panel. We have
Yeah.
of red light. It's a good one. I think it is. It's
Yeah.
platinum LED.
Yeah, those are great. And I'll tell you, where I see the biggest mistakes is, because there's contrast, what you were talking about earlier, going from heat to cold. That's great. It helps with circulation. There's a lot of things that helps with. And we've been using that, quite honestly, in physical therapy ever since I've been a physical therapist, where we would take athletes and you would do contrast with them, and it makes them feel better because it helps circulation, helps inflammation, all that good stuff. But when it comes to red light specifically, red light therapy and cold plunge, the sequence at which you do it matters. It's always got to be the cold plunge first, because red light therapy, this is what I always tell my patients, you're going to get a benefit for this for the next 12 hours. It's going to peak at 12 hours. So I tell them, especially if I'm seeing them after an injury.
And
I'm
how
like,
long is that? I do about 15 minutes.
Yeah, 15 minutes is good.
Okay.
And I even do 20-minute sessions with a vagal nerve reset. So we actually have.
So that's the cold plunge.
No, it's different. We take 2 electrodes, we stick them up to the cervical spine. We put 2 electrodes on their feet, and we run a certain current through their body. So it's a stimulation. Yeah, but it's not bad. It doesn't feel hurtful. It's comfortable. And then we put them in a red light therapy bed for 20 minutes.
Nice image of Frankenstein with the bolts
Yes,
sticking
exactly.
out, just connecting a couple wires.
Exactly. And
You know,
the smoke
I'm already
coming
thinking,
off. Yeah.
yeah.
So we do the
More volts.
Yeah, exactly.
More volts.
We do it just below muscular contraction, so you can feel it, but it's not actually causing you to contract. We do the red light therapy bed for 20 minutes, and then what we do is we pump spa music in there, so it's very relaxing. And that has been absolutely amazing. I've had a couple of athletes who had vagal nerve overstimulation. It looks almost like a concussion. Their pupils are dilated. They are having a hard time responding, hard time with memory. It very much presents like a concussion. And I've had athletes that do as little as 2 sessions, 20 minutes each bout, and it makes a significant change. Pupils return to normal. They're able to answer questions. They actually are able to sleep again. One of the beauties of red light therapy that I didn't know at the time when I first started doing this is the impact on sleep. We have all of our athletes. I'm a data geek. We have all of our athletes track their data through Whoop. And what we have seen on the average is about a 24-minute increase in REM sleep with consistent use of red light therapy. Yeah, because that's where you heal.
Yeah.
It's where you heal. So it's, these technologies that are out there and all the different things that we have available to us today are, in my opinion, game-changing. Because had I had this available when I was 50, I think I'd be in a much better place than I am today. But it's never too late, because you can.
Yeah, that's what I wanted to talk to you about, because to speak to the person who's where I was when I was 55. I mean, I was depressed. I was always an athlete, and active, and now I'm at a point where I don't want to do anything. I don't want to run anymore. I don't want to have sex anymore. I don't want to do anything anymore. And what changed for me was I started doing, I think it was Beachbody.
Yeah.
I saw the ad for P90X. I said, all right, well, I'll give it a shot. I mean, it was brutal.
Yeah.
I was doing quarter tapes.
Yep.
I was doing, but I started.
Yep.
That's what I did right.
Yep.
I started moving, and
Amen.
not necessarily properly, but I started moving. And that led into other things.
Yep.
So there's somebody listening to this, man. It's just right there. They don't want to get off the couch. They got a bag of Doritos in their lap right now.
The biggest thing is do something.
Walking is huge, isn't it?
Walking is huge. Something as simple as making sure you're hydrated. enough, because as we mature, that's my nice way of saying getting older. As we mature,
As we season.
yeah, as we season, as we mature, we see a big change in hydration. It's one of the reasons that people will say they lose height, because the discs between your vertebrae are losing hydration and they're starting to collapse. It's why women lose. They say that their feet grow. Their feet don't grow. Their arch collapses. Why is it collapsed? Because the tissue of the plantar fascia is becoming dehydrated and it's stretching out. It's allowing their arch to collapse.
Wow.
So hydration is super important. It has a direct effect on your mobility and your flexibility. It has direct effect on collagen of your hip joint. Has direct effect on the flexibility of the fascia in your body, something that we don't normally talk about, but fascia is one of the first structures to dry out. And if you've ever peeled a steak away from a bone, you see that white fibrous tissue, that's fascia. You have that through your body, and it's a lot thicker than you might think that it is.
Now, the formula I heard was an ounce for every 2 pounds of body weight. So if you're 200 pounds, 100 ounces a day, that's minimum.
Yeah. And for me, I'm drinking about 1.5 gallons a day. I'm about 205-ish. That being said, it also depends on your activity level.
Right.
Also, there's a lot of other factors that feeds into it. So, what I always tell people is the very best litmus test that you can have for your hydration is, what does it look like when you pee? The color and the odor of your urine, in the absence of asparagus, in the absence of vitamin packs, it should be odorless and colorless. It should be relatively odorless. You can Google urine chart, and on the urine chart, if you're 3 or above, you're doing good. But at 4 and below, you already start having an effect on the rate at which chemical reactions occur in your body. And the reason that that's important is because if you're affecting the rate at which chemical reactions occur, that means that when you go and you work out and you tear down muscle, it's not going to recover as fast. It means when you fall, that bruise is not going to heal as fast, because you're not preparing your body chemically and optimizing it so that it can repair itself.
Wow. Yeah, and the interesting thing is that, obviously at my age, I pee enough, but that was one of the things I collapsed on an airplane coming from Cancun. I was down there. I wouldn't drink any water.
Yeah.
I wouldn't even drink the bottled water. I said, they're in the back. They're putting it on the tap. And, so, that was, we call it my fake heart attack.
Yeah.
I collapsed on an airplane, and thank God we were in separate seats. And right before we got on the plane, I walked over and said, are there any first-class seats open? I'd like to bump my wife and I up. And they said, we have 2. Saved my life. She was there next to me.
Oh, that's
Otherwise,
great.
they'd have looked at me and thought some old man just collapsed because he partied too hard or whatever. And the issue was dehydration. I mean, we didn't know it. I get to the hospital. They reroute the plane. I wind up in New Orleans. A very funny story. They pump me full of electrolytes or whatever. So next day I'm feeling pretty good.
Yeah.
I'm in the heart ward. A woman walks in, lab coat, sticks her thumb in my neck and says, you need a pacemaker. And I go, you can tell that by sticking your thumb in my neck? And she goes, it's called the carotid artery test. Your heart starts up slow, which means you need something to regulate your heartbeat. And I go, I'll tell you what, man, why don't you give my wife and I a second?
Yeah.
And I said, go check and see if she's even a doctor. She could have escaped from the psych ward.
Exactly.
I've seen it in movies. Where's Edna? Huh? She's back in the heart. She's sticking thumbs and telling people they need pacemaker. I'm not kidding you.
That's hilarious.
So anyway, she didn't even clear me to fly.
Yeah.
I had to drive back from New Orleans with my wife. She said, she told Tammy, your husband could drop dead any second.
See, that is absolutely tragic to me.
Well, and then a friend of mine, fortunately, he had a heart attack outside a church. There was a doctor there. They said, basically, he saved his life. Anyway, I call him. I said, who's your heart doctor? He had one, I think it was at St. Thomas. So anyway, I make an appointment.
Yep.
So I do all the tests. I mean, stress test, everything. And at that point, I was in pretty good shape.
Yeah.
So I'm up here and I'm walking. Tammy walks in at one point and says, how's my boy doing? He goes, hell, I'll live us all. Anyway, he looked at me and said, who told you you needed a pacemaker? And I said, the doctor down at Ochsner in New Orleans. And he said, really? And I go, yeah. He goes, wow. prior to Katrina, Ochsner was one of the top 5 heart hospitals in the world.
Wow.
He said, I'll bet you they need money. That should frighten everybody.
Yeah,
You
for
wonder
sure.
how many homeless people are walking around
Yeah.
with the taxpayer-funded pacemakers
Yeah.
and stuff. I mean, you think
Yeah.
about it. For her to do that,
Yeah.
you talk about irresponsible. And there's no other way to explain it than money. So the experts, and that's again what I'm talking about, Sharon, getting through the noise on the internet, especially when it comes to bodybuilding. I got tired of looking for
Right,
answers.
right,
I really did.
right,
I mean,
right.
because there's such conflict. No, this is the way you lift your weights or whatever. At 70 years old now, I'm looking for quality of life.
For sure.
And there is a vanity part of it. I'm not going
For
to
sure,
lie.
for
I
sure.
want to look good. I'm
Yeah.
in a business
Yeah.
that requires vanity. Not
Sure.
saying that slovenly overweight comedians haven't succeeded.
Right. Right.
Been a number of
Right.
them, but they're not with us anymore
Right,
either.
right, right.
So anyway, for people who can't afford, because the Nordic Wave is expensive.
Yeah.
The red lights are expensive. The infrareds are expensive. There are places you go. You
Yep.
can.
Absolutely.
Again,
They're popping up everywhere.
yeah, I went to a place down in Nashville, the Cold Plunge. In contrast, before I bought for
Yeah.
myself, I wanted to make sure it was something
Yeah.
I would stick with.
For sure.
And it was interesting because for the first time, I went on the road for 2 weeks. I did not cold plunge for 2 weeks, and I thought, "Gee, am I going to want to do it when I get
Right.
home?" And God, I felt so good.
Yeah.
I got out of there
You
and
start
I
to
go,
crave it.
"Yeah,
Yeah.
well, that's it.
Yeah.
That's it." So,
And it's like you're craving the feeling you get after, not the
oh gosh,
not
no.
the suck.
Well, it's like lifting
Yeah,
weights.
yeah.
You're gagging
Yeah.
while you're going through it.
But you crave the after feel.
especially leg day.
Yeah. Oh,
Yeah.
I still hate
I
it.
just saw a guy at the gym today. He's doing the curls. He's got guns, and I looked at these sticks sticking out.
Yeah.
You want to walk over and go, you might not want to skip leg day anymore, bud.
Bro.
Yeah, but that's Tammy
Yeah.
will tell you when I was
Yeah.
doing legs in my basement, there was a lot of moaning and
Yeah.
groaning downstairs. They're the largest muscles.
Yeah.
What is the best and most effective way to train legs? Is there ever a routine that you can
But
like
if I
actually look forward to?
if I had to narrow it down to one thing that anybody across the lifespan should do, it's squat.
Yeah.
Squat is the number one exercise to prevent falls in the elderly. Your ability to lower your center of mass, your upper body, the ability to lower your center of mass and raise your center of mass has a direct correlation to your risk for falls. Whether it's getting up and down a flight of stairs,
Which is
or-
the number one killer of people our age, my age.
Yeah, and the average person has 3 falls before they seek attention.
My niece just posted
Yeah.
on Facebook.
Yeah.
She fell 3 times last week.
Typically, people fall 3 times before they seek attention. And the sad part of that is there's a lot of reasons for that. Most falls occur at night.
Yeah.
And one of the things that happens with dehydration, but also with medications, is when you sit up at night and you got to go pee, is a lot of times people will have what's called orthostatic hypotension. It's where your blood pressure drops. So typically what happens is people sit up in bed, they don't give it a second to adjust. They get up in bed and then they take their first step and then it hits them and they start getting dizzy and then that's where they typically fall. So, one of the things I always tell my more mature folks is,
You're so
hey,
kind. The old geezers. You can tell. I can handle it, man.
is when you get up, sit there for a second. Give yourself, a good 3 to 5 seconds to allow that adjustment. Because when you sit up, your heart has to respond to increase the amount of pressure in order to keep your blood pressure up. So your heart's got to pump a little bit harder to get that blood pressure up. And as we mature, that response time for the heart gets a little bit lower. So when you sit up, a lot of times people will be like, "Oh, I get a little bit dizzy." Well, a lot of times you just give it 3 to 5 seconds to adjust before you take that step. The other thing I will tell for the audience who are having those frequent episodes at night where they have to get up and go to the bathroom is get rid of the throw rugs. It is the number one thing that people trip on when they're going from the bed to the commode.
What if you got a dog sleeping in the...
Now that's a different story. Yeah. Or cats that come in and like get in your feet as you're trying to get into the kitchen.
Or leave your gym shoes like right between you and the bath. I tripped on that last night.
My son does that all the time. All the time. Yeah, so anything that's going to be a trip hazard, especially between your bed to the commode. And people don't think about that because typically they do throw rugs on the bathroom floor, thinking, "Oh, this will help me not slip and fall." When actuality, at night, a lot of times people catch their feet on it and it becomes a trip hazard.
Right, makes sense. I was told, and I did this for a while till I have an electric toothbrush, so this became a problem. But it said to brush your teeth standing on one leg 30 seconds and then switch to the other leg 30 seconds. So every time I would stumble, when I first started doing it, I was wobbly and I fell. And the electric toothbrush would go out and spray toothpaste all over my wife's mirror.
There you go.
So it's
now
like
you've fallen.
She came in at one point and I had toothpaste all over my face, and she's going, "What in the hell are you doing?" I go, "I'm trying to keep my balance." I did yoga for years. I'm ready to go back to doing yoga because I for golf for numerous reasons, but to take care of the skeleton and the flexibility.
Well, in the flexibility, especially for as you move into your 50s, 60s, and 70s, and you're still trying to play golf. Number one, making sure you're hydrated, making sure that you have a good flexibility and mobility routine. So flexibility, your strength, your muscles and your fascia. Mobility is joint mobility. Right. And one of the I used to work in Birmingham, Alabama with a real famous orthopedic surgeon by the name of Dr. James Andrews. And one of the studies that Dr. Andrews did was looking at total hip range of motion. So if I sit you down and I take your hip into external rotation and internal rotation, I measure both sides. If you have greater than a 10-degree difference between your right side and your left side, you're 3 times more likely to suffer low back pain. So knowing that, it's one of the things that we look at, for folks who are suffering from low back pain, is we look at your total hip range of motion. And we actually have routines that we put them on that works on hip mobility. And hip mobility is the articulation between the femur and the acetabulum versus the musculature that surrounds it. So hip mobility is very different than hamstring flexibility or quadricep flexibility. And getting both of those is super important as we mature. So like for me, most of my golfers, I'm putting them on a really good hip mobility routine.
Yeah, pigeons.
Yeah, and I'm putting them on a really good shoulder strengthening program.
It's funny you say that because I told you I hired that online golf trainer, and that's today was all lower body and hip mobility. But it's the mobility part. It's not just stretching.
Yep.
I mean, you're moving it with bands and
and hip strength.
Yeah.
We talked about your hip and the glutes. Everybody thinks of the glute max, which is the big butt muscle, and not glute medius, which is on the outside or on the kind of the lateral side of your hip. Major stabilizer for your pelvis in one leg.
Well, that's huge for golf. You got to maintain your posture.
Yeah, absolutely.
Yeah. Do you have a website or something?
I do.
Yeah.
I do.
Because I am sure this is in an area of people have opinions, strong opinions.
For sure.
And they will maybe want to challenge you or
sure.
whatever. Challenge him, not me. I'm a stand-up comic.
Yeah.
I don't know what I'm talking about. We research and we get who we feel are the best we can get. And
I appreciate that.
We and believe me, I want to talk to you before we leave about what I can do, certainly for hip mobility and other things as well. Why do, here's a good one. Why do people, so many people, I mean, you can't read minds, but why do so many people wait until a health scare to change? And how do we interrupt that? How do you really get started. I mean, it's the hormone replacement. Now, I can speak for my wife and I.
Yeah.
We started 15 years ago.
Yeah. Good for you.
In our 50s.
Yeah.
And a game change, a life changing.
It does.
But there's a lot of quacks out there.
Yep.
Tammy got hooked up to save money. I don't know why we did that. I don't know why I agreed to let her do this. We left. I still stayed with the lady I had been with because I felt she was doing a good job and my life was good. Tammy wanted to save some money. She ended up at a place down here, and she ended up bleeding profusely. It ended up, they busted the place. There was not one doctor on staff.
Oh, no.
So please, if you're going to look into HRT, please do your homework.
Yeah.
Find a reputable place.
For sure.
Yeah, and don't just, because I have friends doing this. They just buy the cream. And I go, no, you need you need blood tests.
Yeah.
You need blood work done. You need,
For sure.
this is a science.
Yeah, for sure. And if you've got
If you're a woman and you're walking around with a full beard, probably taking too much testosterone.
Yes.
You
Yes. Yeah, and you have an Adam's apple, then
Yeah.
it might be a little bit
And
different.
you're, hey, how are you?
Yeah, exactly. Exactly. Had a few of those.
Sure,
but,
you're hornier.
Yeah.
But
Yeah. Exactly. So, and I'll say, getting a good reputable provider, super important. At the same time, you also want to have someone who's going to talk to you about the nutrition that you have, because it does have a direct effect.
I want to talk a little bit more about that.
Yeah.
What, as far as, because I have a terrible diet. I know I do. I mean, I don't even question that. Now, we do eat at home, especially summer. My wife gardens, so we have fresh vegetables. We have as much fresh as we can buy. We bought our own cow, grass fed, and we have that sitting out in the freezer, and we're gonna have some of that tonight. So I probably 80% doing well,
Sure.
but the crap I eat, I mean, I eat crap. I mean, I do, and I can feel it.
Yeah.
I mean, I know.
Well, and that's the thing too, is that once you are used to eating better, more on a better scale of types of nutrition that you're taking in, when you resort back and you start having some of the things that aren't so good for you, you feel it.
Well, that's what kills me, because we have chickens, so we have fresh eggs. I mean, and they're so flavorful. And I get on the road and I get these bleached.
Yeah.
They're almost white.
Yeah.
You're like, I can't eat this.
Yeah.
But I should be eating protein, eggs. On the road.
You should be eating protein.
But it's so hard. And then you start reading what Bobby Kennedy came out with, that 2,000 chemicals are legal in America and only like 8.
Which is insane.
I know it is. And there's like 8 in Europe.
Exactly.
There's 2,000
Exactly.
here.
Do you know this is the generation coming up is the first generation in American history that's more unhealthy than the previous generation, and you have to ask yourself, why is that? When you look,
Considering we are the wealthiest,
right,
we should be able.
we're supposed to have the best health care, and yet we start poisoning people at an early age. I really first came upon that when I was doing my doctorate. I did a deep dive into ACL injuries, and as I was doing that deep dive, I got stuck on another deep dive, which was around hormones in young women. And specifically because ACL injuries are more common in female athletes than male athletes. And there's a lot of questions about why does that occur. Part of it is pelvis. Part of it is their femurs are different. Their angles are different. But part of it also goes to hormones. And
So what you're saying, women are different than men.
absolutely.
Oh, my God.
Yeah, anatomically
That's
and
so
physiologically.
controversial today.
Anatomically and physiologically. I know.
I know.
Right?
Email him.
Yeah. I mean, and that's the reason that a forensic scientist can look at a body of skeletons and know that's a female, that's a male, because there are anatomical and physiological differences.
So he's not getting into their pronouns while he's looking at the dead bones?
No, definitely not. Definitely not. And one of the things that we're finding is that females today are menstruating at
Yes.
10 years old.
My granddaughter, 9.
Yeah. So.
Oh no, I take that back. She wasn't menstruating. She had hit puberty.
Yeah.
She started menstruating at like 11 or 12.
Yeah.
Yeah.
So young females are menstruating at a much younger age, and the problem with that is menopause is really ovarian burnout, because your ovaries can only produce so many eggs in a lifetime. And when you start younger, every production of eggs that you do has a large quantity. As you get older, those quantities get less and less and less. So the earlier you start, the greater quantities that you're building. So if you start at 2 years earlier, you're knocking off maybe 8 to 10 years on the back end.
Holy
So
cow.
what's ending up happening is that women are starting to hit menopause at a much earlier rate, much earlier age than it was even 20 years ago. And you have to ask yourself, why is that? And again, it goes right back to what you said. We have so many chemicals in our food. What people don't realize is how much that jacks with all of your hormones. There's a reason that ADHD is higher. There's a reason that cancers are higher. There's a reason that diabetes and all these things are higher.
Yeah, my wife went through breast cancer 26 years ago, and she focused on what she needed to focus on. I started focusing on diet.
Yeah.
And it was fascinating. You look at Japan, where there was virtually zero incidences of cancer in the 60s.
Yep.
And then there's this spike right after they westernized their diet.
Amen. Yeah, I was actually at a medical conference. It's probably been like 5 or 6 years ago. I was speaking at a medical conference. I sat in on another presentation, and it was 2 Middle Eastern scientists, and they were talking about diabetes, and they had this graph, and it was just kind of like steady, 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 and then it goes way up. And that's at the point where they started to westernize with restaurants, and they started to bring in some of these more Western, McDonald's and some of these other restaurants and things like that were jacking up their food system. And you saw a direct correlation to diabetes and things like that. So it's to me, it's one thing that I'm very happy with this current administration and what they're doing from making us healthier, because quite honestly, this has been needed for a long time. And as a therapist and somebody who's been into fitness my whole life, I've been preaching this for 20 years.
Well, we saw a Netflix special where they were jailing a doctor who wanted to invert the food pyramid in Europe. Said this is wrong.
It's insane.
They're going to throw him in jail.
Yeah.
Again, I can't remember the name of the thing. It was on Netflix though, but it was fascinating to see how powerful the food lobby is. And I know Casey Means or Callie Means, one of them, the brother or the sister, talked about this on a podcast I heard, that when the tobacco companies saw the writing on the wall in the 80s with the legal side of it, they put all their scientists to work, and they bought all the food companies up, and they put all their chemists to work on our food system. And again, you naively think as an American that the people you elect have your best interest in heart, but it doesn't take a deep dive anymore to realize that no, they don't. And it's on you, it's on me, it's on all of us to do our own research,
For sure.
and do what's best for our family. I have this argument with my youngest son all the time. My grandson, he's got issues. So texture means something. And I've tried to explain it to my wife, who wants to eat what we put in front. I said, but you have to understand that to him, maybe a hamburger would be like me eating an earthworm,
Right.
In his mouth. So you have to understand this.
Right.
Doesn't mean he has to eat Doritos every day.
Right.
And that's the issue I have is, when he comes to our house, we give him homemade pasta with cream and he'll eat that.
Right.
And carbonara. He loves carbonara with the prosciutto and whatever. But that's, he's one day a month he's with us. The rest of the time he's eating chicken fries and, all this processed stuff.
Yeah.
He's overweight. He's 9. He's just going to balloon up. And I try to the parent who has the kid. Could you at least you're a doctor.
Yeah.
I'm a comic, so why
Yeah.
would you listen to me?
Right.
They will eat.
They will eat.
Just put good stuff in
Yeah.
front of them and then take it away.
Yeah.
At some point, they'll eat.
Yeah. When they're
They're not going to starve themselves to death.
Yeah, and obviously today ADHD is kind of common. Where it used
Well,
to,
it's also,
it's overdiagnosed.
overdiagnosed.
Yeah, absolutely.
I got a 5-year-old. He's
Yeah.
a little distracted.
Yeah.
Well, he's 5.
Yeah,
You know?
yeah, exactly. And
Oh,
he's
he's
a boy.
got ADD.
And he's a boy.
And he's a boy.
And he's a
right.
boy. There are, my son had some ADHD, and his big thing was red dye. We didn't know that at the time, but as soon as he had something that had red dye in it, it was like he had 5 cappuccinos. Like he was off the chart. And simply identifying that one thing and what it did to him and eliminating that from his diet was tremendous. We actually, I should say my wife, who's really good at this, was able to identify all of the foods which would increase his symptoms. And we filtered those out and then just kept him on a diet. We were able to get him off all medications. And he's able to function like a normal, healthy individual.
Right.
And it's amazing. That was like one of the key things in my lifespan that really taught me, holy cow, it's at that point that I realized the only thing that the food system is feeding is the pharmaceutical industry.
Absolutely. My mom, diabetes 2. She started walking and doing Atkins, just eating protein. 6 months, she lost 35 pounds. Doctor told her, you can get off insulin. My mother freaked out, stopped walking, stopped eating right.
Oh, no.
She the thought of living without that thing.
Yeah.
My dad died with a duffel bag of pills. He was hooked on Vicodin for the last decade of his life. He didn't care. I mean, I brought it up to him. I said, you can't be doing that. He goes, that don't hurt. I said, it's a lie. Your body's lying to you.
Right.
You're inflamed. You're hurt.
Yeah.
You're injured. Yeah. So I think our generation of boomers are at least woke up to the fact. And I'm hoping Carolyn's generation, the millennials, will pick it up and push this with our elected officials. And the only way to do it is make them get unelected. I mean, that's it. That's the only power we have as voters is to vote these people out that have sold us out to the pharmaceutical. And it's difficult because of the money.
Yeah.
They'll look at Bobby Kennedy. I thought he was a nut job until I read his book about Fauci.
Yeah.
And I thought, holy cow. I saw it firsthand with Glenn Beck.
Yeah.
When he came out against the status quo.
Yeah.
They circled the wagons. They made him out to be a nut job. And that's all they had to do is they just get enough people to think you're a nut job. They don't have to do any homework because the minute you open your mouth, they discount what you have to say.
Well, look at Joe Rogan.
And Rogan. Yeah.
And yesterday he was at the White House getting Ibogaine approved with the president.
Really?
Yes.
Oh,
And he and Marcus Luttrell were some of the main drivers of getting that to happen.
Now, what is that?
Ibogaine, it is a psychedelic that's used a lot for
for microdosing, right?
Yeah, for PTSD.
Oh my gosh, yeah.
And it's used. There's a really good docuseries on Netflix called "In Waves and War," and I've actually had some of my special forces folks who've gone and done this.
With the doctor.
Yeah.
I
Yes, that should be clarified.
I was taking blotter.
Yeah.
Made by some guy down the street in his basement.
Yeah. This is not something.
When I was doing psychedelics, it was a picture of Mickey Mouse.
You get in a plastic baggie.
Exactly.
You pay the guy in the corner.
Yeah, so please. Yeah, don't, again, this DIY society.
Yeah.
I could dose psychedelics.
Yeah, myself.
Yeah.
But
my dad threw me against the wall once. I have PTSD.
Yeah. There's a lot of really good research coming out about the use of that. And
Sean Ryan covered a bunch of his.
Yes. Yeah, absolutely. So Sean Ryan's covered it. They've gotten it approved. There was an executive order to approve that. I think that, as we get this whole push for health, a lot of these things that we've talked about and that we've known, and that were considered conspiracy theories,
Right.
are really, I think it's opening up a lot of people's eyes. My hope,
Well, I think COVID did that.
yes.
I think
Yeah,
they realized
absolutely.
that the people we have in place to protect us
Right.
are not really there to protect us. And it's certainly now with the information coming out about the vaccine.
Well, you know, there was what people don't realize, there was a lot of research that was suppressed during that time.
Oh, yeah.
You know, there's been a lot of research on increased percentage of clots after surgery in vaccinated individuals. It's one of the things I talk about in my ACL courses.
I think one of the things that saved us, we had the shot, and was we take a small aspirin every day, and we may have saved our lives.
For sure.
You know, yeah, I remember making a joke on stage and getting lambasted for it. Was you know, I've had a lot of vaccines, but nobody ever told me to sit in the parking lot next to an ambulance for 10 minutes after I took one. You know,
Exactly.
yeah, call it what you want. It was
Yeah,
not a vaccine.
right,
You know,
yeah.
but you saw the machine
Yeah.
during because anybody that came out, and I highly recommend Bobby Kennedy's book on Fauci.
Yeah.
Because I lived through the AIDS era. I remember that.
Yeah.
I remember the scare. I
Right.
was a single man when that was coming out. And I was sitting in a bar. Again, this is anecdotal. So, you know, do your own research and your own homework. But I was sitting at a bar in Atlanta, and I was drinking, you know, next to a guy. We started talking. He worked for the CDC at the time. And I said, what's going on with this AIDS thing? And he said, well, if they came out and told you the truth, there's not been one case of AIDS with a heterosexual monogamous couple.
Wow.
The truth was high risk, a homosexual lifestyle, and, you know, basically back alley sex. It doesn't, you know. But anyway, if they came out with that, the funding would dry up.
Sure.
So that planted a seed in my head was they do manipulate information.
For sure.
They not necessarily manipulate the information. They just don't tell you the whole story.
Right.
Because America would react in a way to whatever information. So they that's going back to the early 80s. And then you read Kennedy's book on Fauci with the HIV and what he did to one of the leading immunologists in the world by shutting them down. Yeah. Exact same thing he did during COVID. He picked his favorites where the funding went, and if you went against that, if you came out with any information against that, and again, I know we're getting into the weeds here, and you know, you're going to email Carolyn. Don't email me. I probably won't read it, but I try. You know, I try not to go down these rabbit holes because it takes so much time and it's exhausting, and people believe.
Right.
You know, it's interesting. We just talked to a guest last week on abortion. It's a great book. They lied to us.
Yeah.
You know, and Victoria Robinson, you can get the podcast. And the publisher basically said, we don't publish books on abortion because everybody has their mind made up.
Interesting.
I mean, how sad is that?
Right. Yeah.
That you can go through life and you know, I came to Christ, my mind was made up.
Yeah.
But it got changed through information and of ultimately the Holy Spirit. But the information is available. And again, there's so much noise on the internet. I highly recommend, again, your website. Do you have a YouTube channel?
TheAthleteLab.org.
TheAthleteLab.org.
I do have a YouTube channel. It's at Trent Nessler. I also put a lot of stuff out on Instagram. It's BJJPT_ACL guy.
Oh, my God. You got to shorten that up, man.
I know.
The Ness.
Yeah.
That's it. Just Daness. DANESS.
There we go.
There it is.
There it is.
Daness, man. Or Dr. Ness.
Yeah. So it's
that's a huge. Man, get your pen out.
Yeah.
Let's go through it again. You know, let's repeat it.
Yeah. So it's theathletelab.org.
That one's easy to remember. The Athlete Lab. But you went into the weeds with the Instagram.
Yeah, the Instagram is BJJPT.
I thought you had a young kid.
I do. I do.
Didn't he advise you? I mean,
no, he's not much of a social media.
Oh,
thank God. Yeah.
Oh, they're probably lucky for that.
Yes, I think so. I think so. Yeah, but it's you know, I do put a lot of educational content out there. Most of it is around injury prevention, health, wellness. I'm actually doing a webinar tomorrow on fitness over 50.
Well, this won't be out by tomorrow. So.
Yeah. But I really
do you archive it?
Yeah.
Oh,
It's
okay.
The Fitness Doctor. But we do a lot of stuff. I try to do a lot of stuff to educate people. I'm real big on just education.
Certainly with the peptides
and empowering yourself.
Yeah, just with the peptides today was.
Yeah.
I was eye opening.
Yeah.
Again, I thought it was just
changer.
bubs in a bottle.
It is a game changer.
Yeah.
It is an injection. You have to be willing to accept that. But it is a game changer. I mean,
How often do you have to do it?
It's daily.
Daily.
It's daily. It's daily for like 12 weeks.
Holy cow.
So
and then you're done for life, or?
Well, it depends.
Is it like the NAD? You load.
Yeah, so depends. Like if I have somebody who's coming off an injury, they're doing the Wolverine pack, the BPC 157 and TB 500. So they're doing that for 12 weeks. When they come off of that, a lot of times I will transition them to more of a growth package, which is the CJC 1295 plus ipamorelin.
So do you need a doctor to do this? Or you recommend a doctor?
So I would recommend a doctor. We do recommend peptides to our clients. I actually sell peptides. We're actually a part of a national research project.
For a 70-year-old, is that recommended?
Again, I would definitely talk to your physician about that first.
I'm talking to you. You're my doctor.
And I would look at a functional med doc who really understands all of your.
We joined Function Health.
Yeah.
Mark Hyman.
Yeah.
Yeah.
I've got
part of that. Matter of fact, I got to get another bunch of labs.
Yeah, and two is to have some conversations with your doctor about peptides. I talk to a lot of our orthopedic surgeons, and they are not as versed on the peptides. But I also have other clinicians from around the U.S. who refer to me because they know that we're using it so heavily.
Well, let me ask you this then, because I'm such a skeptic. An orthopedic surgeon, if this prevents injuries, then you're really kind of working against.
Yeah, but the way I
like I want you injured,
right?
And
the way I talk to my orthos about it is, it's going to make your outcomes better. Your ACLs are going to get better faster, and their injury rates are going to be less.
Yeah, I had an ortho come up to me after a show. After I was talking about getting my first hip replaced, and he got in my face. It said, "If you're not going to rehab this thing, don't get it done." He goes, "I'm sick and tired of patients of mine not rehabbing after surgery, then coming to me and going, 'You screwed my hip up.'"
Right.
So I said, "What's the best thing I can do?" And that's when he told me, just do body squats.
Yeah.
He said, "That's if you do nothing else, just 15 times, just a squat.
Yeah.
Get your this area of your body functioning and moving."
When in what I will tell you is, if you can get with a good therapist who really looks at your movement and how you move, it will make a big difference in your life. Because so my doctorate's in biomechanics, human movement. So looking at how people move. And to me, that has a direct correlation to increased risk for total joints, but also what does it do for performance enhancement? And so having someone that can really look and dissect how you're moving, it tells you everything you need to know.
Wow. I'm going to come see you.
I would love that.
Yeah, I'm going to book an appointment.
And we could do a cold plunge.
We do cold plunge, yeah. Is that cool with two men in a plunge, man?
Hey, you never know.
I know.
As long as you don't pee.
I just don't want to ever be perceived as gay. It's a joke. Email him. Yeah. Oh, that would be cool. I'm telling you, man. I'm going to go home from here and dunk. Again, I'm just getting back into the gym, and it's so disheartening because I knew where I was.
Sure.
And then to start now, there was a routine that I used to. My goal was to finish in 41 minutes like they do. It's a very high intensity.
Sure.
It's called a total body, but you're doing, arms, chest, leg, core, arm, chest, leg, core, arm, chest, leg, core, for 41 minutes. And the best I was ever able to do was 48 minutes. I always have to pause it, get my breath, my heart rate get up too high. Yesterday, I only finished 2 rounds out of 4, barely finished 2 rounds. Today, I finished the last 2 rounds on my way down here. And I have to tell myself, I'll get there. I'll
Yeah,
get there. And
absolutely.
again, you'll get there. You'll
Yep.
get there, but you have to start.
You have to start.
And I don't care if getting up and walking to the mailbox and back is all you do. Get up and walk to the mailbox
Absolutely.
and come back. And the next day, go another 15 yards. The next day, go another 30 yards. The next day, go another whatever. Get moving. And trust me, your
Absolutely.
brain will crave it. You will begin to
Your
crave.
body wants to.
Your body wants to be well. And this is. I feel like we were scattered all over
Yeah.
because I led the conversation. I'm sure if Doc led it,
No.
it would have been a little more focused. But go back, rewind this thing, go back and get take what you need, leave the rest. But seek professional help. But you don't have to be in the house. You don't have to be sitting on the couch. You don't have to be the way you are. You're physically. You can get better. Your body will heal, but you have to start. And please look at your diets and the food. And if it's got more than a paragraph, don't eat it if you can avoid it. And this is coming from talk about someone preaching to the choir. I'm preaching to myself. I am on the road. It's difficult. I get lazy and I shove things down my throat that I know are not good for me. We can do better. We can do better. We can do better with people we elect. Please pay attention to the people you elect and vote for. And are they in the pockets of people who want to poison you or who don't really care about you? Silicon Valley is another one. They send their kids with pencil and paper. They don't even let them on their devices. So only follow me on social media. All those other people, don't follow them. Just follow me. I'm good for you.
There you go.
This is how cults start. Thank you, Dr.
Thank you
Nessler.
so much for having me. I really
thank
do
you for
appreciate
coming
it.
up.
Yeah,
I know it's a
absolutely.
little hot in here.
Yeah.
We lost the light. Oh, it's
Yeah,
back
that's all right.
on. So
That's all right.
yeah, at some point the lights went out. Thank you so much if you stuck through this, man. God bless you. You have some patience, and you're obviously not ADD. Subscribe, hit the button. Come on out. I'm on the road all over the place. 110 different cities this year in my first final farewell tour. And please, it's the first final one. Don't come to me and say you're quitting. No, I'm not quitting. I'm having too much fun. You guys are the best, and I do. I've heard entertainers say this all the time. I do love you guys. I get the chance to shake your hands and meet you while I'm out on the road. And I have the best fans in the world, man. And thank you. And God bless you.
God bless. Thank you.